So looking at another surgical option is the sacral colpopexy, or you could say the sacral colpopexy. Okay, so the two of them. Alright, so for this surgery, how is it done and why is it done? Right, that's everything we'll actually be looking forward to. So for sacral colpopexy, you know, you can start seeing some things, right? But you not really understand it till I go into the lecture. Alright, so it's just a surgical procedure. It's used to correct what? Pelvic organ prolapse. So it's like I'm holding the organs and tying it to your backbone. Do you understand? So they won't collapse again, right? So particularly when the vaginal vault, that's the top of the vagina, has dropped due to weakened pelvic support. So it's often performed after hysterectomy. You understand? Maybe they removed the uterus, okay, and aims to restore normal anatomy function. Alright, so how it works: the surgeon attaches the vaginal apex to the sacral promontory, that's the bony part of the spine. I'm putting some tissues here, I'm stitching it, I'm now attaching it to the back of the sacrum. Now this is because I don't want it to fall back, okay? You understand? So that was the whole thing, you get. So this mesh, that's like this thing around the you know, this part tying it up, is a mesh, right? It acts like a sling, lifting and securing the prolapsed organs. The procedure is typically done laparoscopically or robotically. Okay, so laparoscopically, like, you know, they open tiny, you know, and all of that. Okay, so what we have is what? Conditions treated. Like, in which conditions will you actually need this type of surgery? Okay, can I say you tie this, you stitch, you tie it at the back here, so that no organ prolapse. Okay, so conditions used, it have vaginal vault prolapse, uterine prolapse, Cystocele, okay, Rectocele, right, Enterocele. You use it for all of that. So benefits: it restores the pelvic anatomy, okay, improves symptoms like bulging, pelvic pressure, urinary incontinence, offers durable results with high success rates. Okay, so risk and recovery is, you could have mesh complications like erosions, you could have bleeding, injuries, okay, to the organs. Recovery may take 6 to 8 weeks with activity restrictions like avoiding heavy lifting.